Welcome again to our Africa Climate and Health Responder course, session 10 on health service delivery and sustainability and adaptation. And let me advise you that there is interpretation for this course. So you are free to click on the globe icon there. There's interpretation in English, in French, and in Portuguese. And also be reminded that this is a 11-session course, which takes place every Tuesday and Thursday. And today we are on session 10, and congratulations, we are almost towards the end, and you have been doing so well. Today's session is on health service delivery, like I said, sustainability and adaptation. And the next, which will be the last session, it's section 11 on October 22, which is on climate and health research and funding in Africa. Note that there will be certificate offered to you for participation, and participants who attend 8 or more of the live Zoom sessions and pass the final exam with a score of more than 70% at the end of the course will be awarded a certificate of participation in climate and health from the GCSHE. And also note that the certificate of participation is only available to people who use the same email address for registration for all Zoom sessions and exam. And also attendance is automatically recorded during the live Zoom sessions. Your individual attendance is also counted if you join using your personal Zoom link. This means that your attendance is not counted if you join with your colleague's link. You should always use your designated Zoom link linked to your email address. And also YouTube views will not count towards attendance. There will be a final exam, and then the exam must be completed using the same email address used to attend the Zoom sessions. The exam link will be sent via email and WhatsApp on the final day of class, which is on the 22nd at 11:59 p.m. and will close on Sunday, October 27th at 11:59 p.m. The format, it will be a 25 multiple choice and true or false questions, and participants should be prepared to take the exam in one sitting. So there will be no chance given after that opportunity has been given. So these are the objectives of our lesson today. At the end of the lesson, you should be able to apply the concept of sustainability and adaptation to the healthcare sector and explore examples of how healthcare systems can perform both sustainability and adaptation, and also be able to identify ways in which healthcare facilities can become more resilient in the face of increasingly severe or frequent climate-related weather extreme. Use emergency planning skills to plan for and respond to climate-related extreme weather events and disasters, including workforce, surge needs, and disruption of infrastructure critical to maintaining access to healthcare and emergency services, and distinguish the roles of an interaction between agencies involved in emergency care. You should also be able to describe how health professionals can partner with healthcare institutions, professional organizations, and advocacy groups to reduce healthcare sector greenhouse gas footprint. And today we are excited to have our 3 speakers for the session. We have okay, I need the screen for the speakers. I think I've pressed a wrong button. Okay. Just pardon me. We have Dr. Rudolf Abugnaba-Abanga, who is the chair, Climate Resilient and Sustainability Systems in Ghana. And also we've got Dr. James Irlam, who is a senior lecturer, Climate Change and Sustainable Development, University of Cape Town, and also Professor Saloshni Naidoo, who is a professor and head of discipline, public health, University of Natal. So we'll have our first presenter with Dr. Rudolf, taking us through for his 40-minute presentation. Then he'll be followed by Dr. James and Professor Saloshni with their commentaries. So I'll now ask you, Dr. Rudolf, to share your slide while I read your bio.
Okay.
Okay. So Rudolf is the
Yes.
Deputy Nutrition Officer with the, I can't pronounce this word very well, it's Presbyterian Church, of Ghana Health Service to bring over 20 years of experience in public health, working with diverse stakeholders. He serves as the Vice Chair of Africa on the thematic working group on climate resilient and sustainable health systems at Health Systems Global. Rudolf is currently a PhD candidate at the University of Development Studies in Ghana. His research focuses on climate resilient and sustainable health systems in low resource sub-national settings. And as part of his doctoral studies, he was appointed as a guest researcher at the International Development Studies Department of Human Geography and Spatial Planning. Recently, Rudolf was appointed as an adjunct research fellow at the West Africa Center for Sustainable Rural Transformation, University of Business and Integrated Development Studies in Ghana. So over to you, Rudolf.
Yeah, thank you very much, Vincent. And then good afternoon from Ghana. Good evening, wherever you are. And then I hope we enjoy the next 40 minutes and then you help me explore with you together. I hope you can see my screen very well. The session objectives has already been dealt very well with Vincent. As much as possible, I'll try to cover. I hope that it works out well. Then again, first of all, I would like to explore with you on the nexus between climate change and health systems. I have this experience where people usually would think that this is a very big thing, but there are also a lot of things that we can connect. And then moving on, I would also love to share some international frameworks, at least those that I believe that they have been validated for building climate resilient and sustainable health systems through facilities. Then next, I'll be going with you on using the WHO frameworks for building climate resilient and environmentally sustainable healthcare facilities. And then again, the emphasis with the WHO framework for me, it's because one, their tools I've used a lot. And then most importantly, I think a couple of weeks ago, WHO Afro had also seen climate resilient and environmental sustainable health systems as a priority area. So I'm sure the member states decided this, and this is going to be something that we are going to get used to coming on from WHO. And then finally, I hope that we can touch on the key principles in building health disaster risk management and response systems in country and at subnational levels. And then again, in my work, we and then some primary healthcare actors have together co-created a flexible framework for intersectoral collaboration. I would share that with you, and then it's very adaptable, and I hope that it can help you in your work. Now, I do have a couple of pictures just to show the link with you. Now, I'm hoping that you can see my pointer. Obviously, that is a cemetery. This was flooding in Ghana last year. Whole communities were flooded, and then the cemetery was flooded as well. This tells you what can happen, the kind of disease outbreaks we can anticipate with this kind of thing. And then health systems obviously should be prepared to respond to things like this. Then the next one where the pointer, I took it from the WHO Afro. And then I think it's a health facility in Madagascar. As you can see, is thoroughly ripped off by a storm. And then now you can ask yourself, those that need help medically, where are they going to attend to? And most importantly, how about those that were in there at the time this storm was coming? Are they going to secure more injuries, or what happens to them? And then now I also have a third picture where it is from Nigeria. I took it from a news portal from Nigeria. And then you have a toilet facility. Now you can already see down there, obviously the toilet is not being well used. And then I asked a simple question. If there is a drought, how hard is this going to hit on the health facility, the users, the staff, and everybody, infection control and everything? And then again, if there's a flood, what happens to this particular toilet facility that we see? This has a potential to explode. Now, from another news portal in Ghana, obviously you can see there's a bushfire. I am sure most of you that live in rural areas or familiar with rural areas are very familiar with scenes like this. That is a bushfire. And then in this bushfire, you can see an electric pole that has been bent. Obviously, this is a high tension pole carrying electricity to a number of communities where there will be health facilities. So now tell me what happens to their cold chain systems in there. Are they going to be able to store vaccines and refrigerating dependent supplies properly? And what will be the impact on this? And then again, so if they do not have backup systems like solar systems, again, then we have a problem. Then now, to the left corner of this, you are going, obviously can see that is a health facility in my own country, Ghana. It was a newly constructed health facility. And then what happened was that it was designated for Corona. So they were supposed to get special care. And this suddenly gets flooded. Now you go in there, you have Corona, you go in there for treatment, it gets flooded. What's going to happen to this? And then finally, and my most favorite picture is this beautiful health facility, 800 kilometers from the capital of Ghana. It's supposed to serve a population of about 5,000. It's a community-based health facility, newly constructed. When I saw it, I clapped hands for the government of Ghana for doing that. That's very rural. But if you look lower the picture, you see corrugations. It's absolutely constructed in a muddy area. So when it rains, then the staff can't come out, and then those who need help can't even go there. They'll get stuck before they get there. So now, when we talk about resilience of health systems, these are some of the things that we need to look at, and that is the connection. I know a lot of people find it difficult. They can associate climate change and health, but remotely it's difficult for them to talk about the resilience of health systems. So these are some of the things, and sometimes it's about little decisions. For instance, what came into the decision to site this facility here? Well, everybody knew it was a muddy area. Why didn't somebody think of it? Why did we invest there? And it is now prone to a climate disaster or floods, and then it cannot be used. So I go to the next slide. I believe you might have read already that health systems or the health sector accounts for about 5% of global greenhouse emissions annually. That's huge, very, very huge. And then I also illustrate these from examples in my home country. That's where I've done a lot of research. And then now on this picture, obviously, you can see that that is a site for disposing medical waste. You would all agree with me that this is not how medical waste should be disposed. There's burning, it's open, it's burned, it's been burned, and then anybody that passes by there, it's probably at risk of getting a sharp cut or something. And then that is one of the things we talk about when we talk about environmental sustainability. Now, in the middle, these are people that are disposing medical waste. First, they burn it in the open. You can see there's a tricycle there. People are collecting these and they are going to transport it to a bigger site somewhere. Now you can tell that, okay, this is not something that is fair. And you can imagine what happens to these people that are collecting it. They are wearing gloves, but these are not proper gloves, of course. These are medical gloves. They are not meant for these things. And look at the way they are going to transport it to the bigger dumping site. So obviously, the health systems is not operating sustainably. Now, this final picture, one of my favorite pictures too, you can see two beautiful persons wearing our traditional dress, batik. And then obviously they are coming from the hospital, or at least I know that. And you can see somebody carrying a polythene. Now, this is the practice, and I'm sure it's widespread across Africa, probably, and many parts of the world. You go to the health facility, you get your medication, and it is given to you in a single-use disposable plastic bag. Now, in Ghana, with a population of about 30 million, we have over 1.6 per capita attendants. So I can safely say that, well, it is possible that the health system is producing 30 million of these bags. How do they get disposed? Do they get disposed like this or like in the middle picture? Obviously, there's a big problem. We are running into a big problem. And these are the concepts of environmental sustainability. They are things that we don't need lots of money to do. They are things that we can take decisions that we can make as health service providers that can help us become sustainable in our own little way. In the next slide, I would also like to touch on a number of international frameworks, which I know at least have been validated and then are very important. Some are being used in Africa, just to give you an idea before we zoom into the WHO frameworks. Yes, so to my left, this is also this is the first framework I want to discuss. There are two actually. The first is the Hospital Safety Index that you can see here. This is a widely used index globally, and it was initiated by the Pan American Health Organization. That's the wing of WHO. And then again, this has been used in over 35,000 health facilities across the globe. So it's very well validated. It's been used, it's good. And then again, it provides a snapshot of hospital level of preparedness during emergencies and disasters. So this is a tool that can be used, but again, it is focused on just health facilities. It's focused on disaster preparedness. But again, there's no emphasis on sustainability with that. And I think based on that, PAHO also tried to improve this. So they introduced the Smart Hospitals Initiative, I think a decade after using the Hospital Safety Index. And then this is the core principle of this is to make health facilities climate resilient or safe, and then green in addition, that is environmentally sustainable. And then what the Smart Hospital does is that it kind of gives us the opportunity to be resilient, health facilities to be resilient, and then again, they are green. And then this Smart Hospital Initiative has a toolkit. Basically, it uses about 4 different toolkits that can be very difficult for people to use. One of them is the baseline assessment checklist, the climate satisfactory surveys for the non-structural elements of the buildings. And then again, the one that I like so much, it's the green checklist and guide that will help people make their health facilities green. And finally, the cost-benefit analysis. I think that is the biggest strength of this framework, because for people to really buy into the concept of health services sustainability, the resilience, then the cost element, you cannot run away from it. You need to be able to demonstrate to the health system decision maker or the policy maker that, look, it's worth investing in this, especially from where we come from, where we are non-historical emitters, but again, we are facing the brunt of climate change. So for me, that is the strength, the biggest strength of it. Now, the next one is the climate smart healthcare. This is basically by the World Bank, supported by WHO. I think that this was produced a couple of years ago, around, I'm not too sure of the year, but not more than 2 years. And then again, the concept of climate smart healthcare, it's that to become climate smart, for a health facility to become climate smart, it's an intersection of sustainability and resilience. And then what do you mean by resilience? We have the risk, disaster, and disaster preparedness and planning. For example, climate-related disease monitoring, flood barriers, elevation, and backup generators. They say generators, but for me, it could be wide generators. If they are generators, they should be using renewable sources and the rest. And then again, for sustainability, that is to my extreme, the circle on the left, we have the work on lifestyle disease prevention, and then low vogue materials and local food supplies, waste recycling, and improving air quality. Improving air quality obviously focuses on intersectoral collaboration, because it's not in the domain of the health sector. So now they claim that, or they are saying that the World Bank thinks that to do climate smart, then it's an intersection of sustainability and resilience. That is a health system strengthening, universal health coverage, and then energy, water efficiency, and then using renewable sources and the rest. So again, they did not just produce this framework, but to my right, you have what we call the diagnostic. It is a World Bank supported by WHO. This is largely a qualitative tool that is meant to facilitate action-oriented dialogue to identify climate-related events, shocks, and stresses that undermine the effectiveness of health systems. Overall aim of this is prioritizing interventions leading to establishment of climate-smart health systems. This has been used in Madagascar. So it is kind of validated. Madagascar has used it effectively. They used it for their climate-smart programming countrywide. So that is also well validated. Now I move to the fourth one, which I believe you are going to get a case study on it. This is coming from the Global Green and Healthy Hospitals Network. And then they have a comprehensive guide that focuses on 10 goals. That's leadership, number one. Obviously, leadership has to prioritize environmental health. And then chemicals, number two, which says that you substitute harmful chemicals with safer alternatives. And then waste, you reduce, treat, and then safety, dispose of healthcare, which you already saw in the earlier examples and pictures that I had given. Then obviously energy, we talk about energy efficiency and renewable energy. And then I want to focus on this a bit. I think that one of the things that we can also do in our little ways is to kind of conserve energy, even if we don't have control over the energy sector. I think it's important to conserve as well. Water, it's the fifth component. Transportation is number 6, and you know how we can use a lot of transport in the health sector. Food is another one, pharmaceuticals, and then our buildings, of course. Our buildings should be green, they should be well constructed, we should be using natural lighting and other things, and then purchasing. So we buy sustainable products. So that is the other framework that I think that is well validated and can be used by everybody. And these are the four I want to touch on. And then that doesn't mean that there are no other frameworks that are very good, but for the purpose of this, I'll stop here, and then I'll focus on the WHO frameworks like I've already told you earlier on. Now, the WHO basically, in 2015, they adapted the conceptual framework from DFID. I think, yeah, they adapted it from DFID. And then, as you can see, what they are trying to say first, you need to understand the context, the health systems, and then the nature of the shocks, number two, that would disturb the health system. And then again, there is number three, capacity to deal with these disturbances. So this basically depends on your level of exposure and then your vulnerability. So if you are highly exposed and then your health facility and its staff and components are also vulnerable, what it means is that if you don't increase capacity, your health system has the tendency to collapse. That's what they say is about choices and opportunities. So if you invest in building resilience, then what we mean is that when there is a disaster or a climate disaster, there are situations where the system can collapse. It depends on the kind of disaster. It doesn't necessarily mean that if you build resilience, health facilities or systems cannot collapse. If you have a kind of if you have a kind of disaster that actually is overwhelming, the health system can collapse. And then again, it can recover. But again, the emphasis is that even if we have a disaster, once you invest in capacity and then you reduce vulnerability to your exposures, then what's going to happen is that at least you are going to be able to manage during disasters. And then again, you are going to be able to recover at least to pre-event state, or you can recover, learn lessons, and even transform to become better. So based on this framework, the WHO has some key definitions. And then first, they define a climate resilient health system as one that is capable to anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and stress to bring sustained improvements into population health despite an unstable climate. So it has to anticipate and then respond to and cope. So that is what we call climate resilience of health systems. Then again, these things keep changing. And then in the middle, the WHO had kind of updated this whole framework, and then they have another definition, but at least the core form is the anticipate, respond to, cope with, and then again at the end, it talks about minimizing greenhouse emissions and other negative impacts to delivery of quality care and then well-being of present and future generations. That's the WHO 2023 when they talk about climate resilient and low carbon health systems. Now, today, for me, I see them as a matter of terminology, and I believe that whether you are talking about climate resilient and environmental sustainable health facilities or climate resilient and low carbon health systems, it's a matter of emphasis, and then they reinforce each other all along. So a climate by the WHO in 2020, they defined a climate resilient and environmentally sustainable healthcare facilities as ones that anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and stresses, while minimizing negative impacts on the environment and leveraging opportunities to restore and improve it, so as to bring ongoing and sustained healthcare to their target population and protect the health and well-being of future generations. So that is the formal WHO definition for climate resilient and environmental sustainable healthcare facilities. So all these three definitions, you can actually see a lot of things in common. And for me, it's a matter of terminology and emphasis, but I think that they mutually enforce each other. Now, the first thing, earlier on, I had told you that the WHO framework, apart from it being adapted by Afro, that is the WHO Africa region. Again, one of the advantages for me is that it also provides the opportunity to do a systems analysis. It takes a systems point of view. You know, usually we have health systems, and the health facilities are a critical component of health systems. So policies, decisions can largely be taken out of the health facility, but the health facility has to implement it. So again, initially there was a framework, like I told you earlier on, that was called the Climate Resilient Framework that was developed by the WHO in 2015. And then again in 2023, this was updated. It was updated to something that we call climate resilience and low carbon health systems. And then what this does is that it's saying that, okay, can we kind of reinforce the 6 building blocks of every health system, and then said that they'll become climate smart. So for example, I believe you'd have seen this in your earlier presentations, when we talk about health workforce, how can we make it climate resilient? So we need to do what? Make it our climate workforce climate smart. That is by building their capacity, supporting them, and providing the resources for them to be able to act effectively. So now they have this tool, the WHO has this tool, 2022, where they have a framework for measuring the climate resilience of health systems. And there they give us a step-by-step approach to doing this in all these components that are spread here, the 10 components, as you can see. Now they have suggested indicators that nations should use to kind of measure these. Now, in the next slide, I am going to give you an example that I hope that it will be useful. So in this one, this is an example of an assessment that we did in Ghana. And then what happened was that we adapted it to a PhD system. So the framework that I showed you for measuring health systems, it's actually structured for national health systems, but again, they are all adaptable. And then we used the indicators, suggested indicators, but what we did was that we kind of structured them or adapted them to meet a PhD system, because it's not all national indicators that are applicable to PhD systems. So what we did was that we tried to do a scale of 3 to 1, and then 3 meant that there was incomplete preparation or unable to respond, and then 2 meant that there was incomplete preparation or able to respond, or in this one, and then 1 actually meant that, okay, you are well prepared. So what we did was that we tried to analyze this with primary healthcare managers, where we administered this checklist, and then they all scored, and then we weighted them. So if you look at the color coding across these 10 components that you have already seen, anything that you see green, so green is able to respond, and then when you see red, then it means that you are just not prepared. You're unable to respond to anything. And then when you see yellow, it means that there's incomplete preparation. So we applied this, we analyzed it, we weighted them, and then the WHO doesn't have an index or anything to do this. So this was our own innovation. So adaptation is very important. You need to adapt these things. And then once we did this among 3 districts and we had the average of it, you realize that, unfortunately, in all the components, the overall preparedness, there was incomplete preparation among all these PhD programs that we have done. And then again, you could see that climate health financing was almost red, 2.5. And then you can see that in one of the districts is completely red. So this is just an example to show you how you have to adapt these things to ensure that they work for you. So now the next framework is the WHO framework for building climate resilient and environmentally sustainable health facilities. And then, as you can see, there are a number of hazards that the WHO identifies. But unfortunately for me, this is not exhaustive, but these are just frequent ones. In your locality, there could be hazards that are not even captured here. So in using it, you need to be mindful of that. But I can assure you that all these things simultaneously appear in your locality. What this framework says is that if we want to make healthcare facilities climate resilient, we need to work on the health force, water, sanitation, hygiene, and healthcare waste component, the energy component, infrastructure, technology, and products. So if we make these four components climate resilient or climate smart, then our health facilities can become sustainable and resilient to environmental stresses like storms, floods, droughts, and the rest. So we are going to focus on this for the rest of our session. Now, I think that generally there must be prerequisites for mainstreaming. If you don't have these prerequisites, it's not going to work. Obviously, policies, we must have awareness, political commitment, and then national health policies. If your national health policies don't recognize this, it's going to be difficult to even start something because the health systems is a heavily regulated industry, and then they get stuck to their systems, policies, and protocols. So any other thing that doesn't fall within it's an addition, and then it might not be considered as serious as it is. Now, apart from national health system policies, which obviously in Africa, most health systems are now beginning to incorporate climate action. There are other opportunities that exist. When I say policy, what do I mean? There are local government health development plans, there are hospital facility work plans, there are community health system plans that can be leverages to enter to implement this. So importantly, capacity building, it's a prerequisite because if the health actors and the health determining actors don't understand the nexus between climate change and health and why health facilities should be climate resilient and sustainable, then you are not going to get the cooperation and you're not going to move on. So for me, the number one prerequisite is that you need to kind of get buy-in through policies or support from other people. This is an example from Ghana. I have a master plan for climate action, which says that health is a priority sector. And then I just tried to search health in the document, and I get about 447. It ended in 2020. In 2020, the National Health Policy was revised. This was the master plan for climate action that identified health as a critical sector. They had just developed this in 2020 and I searched for climate and it's zero. So it tells you the policy inconsistencies. And then again, they need to already have that commitment with mainstream. I hope this example helps. And then it tells you the importance. So in this situation, it's going to be very difficult for some of the actors to take resilience and environmental sustainability quite serious because there's no that policy direction in it. So even though it's in the whole Ghana master plan, health is a priority, it is absent from the health system framework for bringing health to people. So that is an example of policy inconsistency and how it might affect whatever we do. So now the mainstreaming process, according to the WHO, it's a 5-step process where you need to assemble and train a multisectorial team. And then again, we need to establish a baseline of the health facility that is hazards. We have storm, floods, droughts, heat waves, etc. And then we also need to know the vulnerabilities around the area. And then we also need to assess the impact of the health workforce on water waste, on the health workforce, water waste, energy, infrastructure, etc. Then once we establish this, we can proceed to define and prioritize our actions. And then we develop an implementation plan. And then we integrate it into the we monitor and evaluate for improvements. But it's very important to note that if you do not integrate this into the health management information systems, it's going to get out. So that's very important, step 5, and it remains cyclical, keep on going till you get there. Now, how do I even, as somebody, determine which hazard my health facility is exposed to? Now, in that same W framework, they have a checklist. They published a whole document in 2021. That is a checklist that is accompanying the framework. So help health facility managers and stakeholders kind of assess their health facilities. So there's this hazard identification template, which first you need to administer to teams in health facilities to know what kind of hazards they are exposed to. And this is an example from the work we did. So we for the period of September 2022 to 2023, we administered this to a number of health facilities. And one of them says, okay, flood, yes, the hazard is present. And then it has impacts on all the 4 components. And then so it says that, well, the storms, yes, storms exist, but it has no impact on all our components. Logically, you have the tendency to think that, okay, flood is a problem. But I can tell you that for me, once it exists, this can change. You know how climate variability is. So you then go ahead to proceed with both floods and then storms. And of course, there was no sea level rise. So it means that your health facility is not even exposed to this. So you don't even need to proceed to the next stage. That is the checklist. Then now, this is a typical checklist from the WHO, checklist for assessing the vulnerability and environmental sustainability of healthcare facilities. So it's a set of questions that you apply, and they're ranked into high, medium, low, and then you tick them, and then you move them. At the end of the day, you're able to analyze it, and they don't have a specific format for analysis. So you have to adapt this to your situation to at least know the capacities that you have or your weak spots or your health facility to proceed. Then again, after that, we have what we call the impact checklist. And this is an example from floods. It is also it's a checklist that you do to see the major, moderate, and minor impacts this has on your health facility. So once you do this, and then you analyze your data, then there is still a planning template where in the 4 components where you need to plan as to how you mitigate this or you improve this. And an example to my right is what we did in Ghana. And then you can see when it comes to health workforce, they say, look, number 1, siting of health facilities on high ground. That's very important. That's cost effective. You are building a new facility. What's the decision to go and put it in the flood prone area, like I showed you in the picture there? So this can be done that way. But the most important thing is that we need to integrate climate change adaptation and mitigation, or sustainability and resilience into health systems or facility policies, program work, and include accountability mechanisms. Otherwise, they are a heavily regulated area and they are not going to mind you. There's a concept we call tick mainstreaming. So where tick mainstreaming means that you need to be able to put this into the work plans. You need to monitor these and you have to have accountability mechanisms. Otherwise, they will feel responsible for it. Now, I can see we are running out of time. In developing health emergency and disaster risk management frameworks, there are a number of things that we need to take into consideration. And then at least we already spoke about policies, strategies should be integrated into the national health policies. Planning coordination is very important and ensure there's continuity at every level. There should be adequate human resource planning, because without the human resource, you cannot even respond to emergencies and disasters. Obviously, the finances are important, and then we need to have coordination, real-time access, and exchange of information between the community, the health facility, and then even other health determining sectors. And then again, our infrastructure and logistics should be safe and secure. And actively, we should have participation of communities to be able to get this successfully done. And then again, indicators should be standardized and integrated into the health management information systems. Like I said, otherwise you are not going to be able to monitor this. And then lastly, this is a collaborative framework, which we call the tick mainstream framework, that I developed or we co-created in collaboration with health service actors in Ghana, specifically primary health care. And then, like I told you from the Ghanaian situation, it is beginning to change. But at that time, there were no active policies within the health systems that will encourage climate action or climate resilience and environmental sustainability in PAC operations. So what we needed to do is that we actually, after we had assessed everything, we needed to see how we could put this in context. We could get it recognized by the local government authorities. So we identified two levers of integration, and that was the district health medium-term development plans. That is, the local government authority has a health development, medium-term development plan. And then we saw that as a lever for integration. And then we also saw the routine reviews of the health systems as a lever for monitoring. And then the second one was intersectoral legally mandated bodies. And that is an example is the district health committee. This is a multi-sectoral legally mandated body that has all the health determining sectors, and the one who holds the budget, the head of the local government authority, as part, which they develop these plans and they use it for action in their health systems. So we also identified that one as it, and then we began to say that, okay, first, if we want to get this right, we need to integrate, we need to orientate or train this district health committee, that is the legally mandated body. And then once we train or orientate them and we get their buy-in, we mainstream them, we mainstream it into this district health sector medium-term development plan. And once you mainstream it in, you have the legal mandate to work on climate resilience and environmental sustainability. Then you can orientate healthcare facility managers and staff. Then you train them to apply this WHO checklist for assessing environmental sustainability and climate resilience. And then they can develop climate resilient improvement plans. And then you mainstream these plans into health sector annual work plans or health facility annual work plans. And then once you mainstream it, you also mainstream it into the performance reviews of these health facilities, so that you begin to be able to put it, you have to take a systems approach to it, and it's still cyclical. And like to end, I talked about adaptation. These checklists are global checklists. They are not adapted for different types of health facility. But from my experience, I think that it's better to have health facilities applied, even though they are so global, but they still make sense, to apply this, and they begin to learn in all this cycle and continue to move on. And once you get this ready, I think that you are able to support other health determining sectors and get their buy-in to be able to push and probably finance climate resilience and then environmental sustainability. So the long and short of it, and to conclude, it's that if you are a health facility, you need to identify your entry point. Do you have work plans? Do you have a management body? Do you have a board? That becomes your entry point to ensure that there is a buy-in, and that can streamline climate action into health facility operations. So I think that I've overrun my time by 1 minute, but I've finished what I want to do. I will end here, and then hopefully we can get to discuss, and then maybe in future we'll have much more time to go this into detail. And thank you for coming, and then I'll hand over to Vincent. Thank you, Vincent.
Thank you. Yeah, thank you so much, Rudolf. And thank you so much for also maybe checking your chat. Okay. And also I want to say Rudolf will be presenting as well in Harare next week. So those of you who are interested in this subject, please register and travel to Zimbabwe, Harare for the CHAC conference. And there will be a lot of discussions in this area. He's very good when it comes to health system strengthening. Thank you so much. And also, please put your questions or comments on the chat or on the Q&A section of the Zoom, and we'll capture those questions for Rudolf later. So the next speaker, I'll invite Dr. James Irlam, and Dr. James Irlam is a senior lecturer in the Department of Family, Community and Emergency Care and the School of Public Health at the University of Cape Town, Faculty of Health Sciences, where he is active in promoting environmental sustainability. James is the founder and chair of Education for Sustainable Healthcare Group within the South African Association of Health Education. He holds an MPhil in epidemiology and a Master of Science in Climate Change and Development from UCT, and also a PhD on education about planetary health and sustainable healthcare in South Africa, health professions education. Over to you, James.
Thank you, Vincent. Thank you, Haley, and all the members of the team, and good afternoon, everyone. So greetings from Cape Town, South Africa, and in the next 10 minutes, as has been said, I will be speaking a bit more about some case studies from the Global Green and Healthy Hospitals Network that you heard about from my colleague, Dr. Abanga. 4 case studies that illustrate savings in waste, energy, water, and food, and that illustrate the importance of leadership and community engagement. So there you see the 4 case studies that I will briefly present. Vegetable garden at Polosong Hospital in the city of Ekurhuleni near Johannesburg. Water and energy recovery from an autoclave system at the New Somerset Hospital in the city of Cape Town. Rainwater harvesting on a new facility in the city of Cape Town, and then community-supported waste segregation and recycling at the Telomogerane Regional Hospital in the city of Boksburg. So to start with the vegetable gardening project, this case is from the Polosong Hospital, which is a 483-bed regional hospital in the city of Ekurhuleni. And the issue here is that malnutrition contributes significantly to non-communicable diseases such as diabetes and obesity in the community, and there's very high unemployment and poverty. Also, the hospital kitchen sometimes has limited vegetables due to a history of poor delivery by the service provider. And then they also identified limited therapeutic activities for hospital inpatients. So the project, therefore, was to establish a vegetable garden, the committee of multidisciplinary hospital staff and community members. They identified a tract of land and registered the garden project with the Provincial Department of Agriculture and Rural Development. And with a donation from the city of Ekurhuleni and seeds and gardening equipment from the department, irrigation was installed and training was provided to gardeners to enhance their planting skills. A diverse group of stakeholders in the committee each brings unique perspectives and expertise that make the project successful. And these include a community representative who recruited 7 community members to work in the garden, occupational therapists and social workers who allow patients to participate in cultivating and watering the garden, dietitians who identify malnourished children and advise their mothers and guardians about nutritious food, community workers who visit the garden daily for cultivation and monitoring progress, and environmental health practitioners who assist in monitoring the project. The progress of the garden is also reviewed every month during meetings of the garden committee to address any problems. And there were some problems. There were several startup challenges, which included a need for more tools, manure, a garden fence, water sprinklers, and integrated pest management. Hospital management allowed fencing and a sprinkler system to be installed, and the department donated tools and other supplies. The committee developed an agreement to allocate 70% of the garden produce to community members and 30% to the hospital. And in their first year, 20 patients and families were able to receive vegetables from the garden. The team were able to provide the kitchen with vegetables when the contract with the service provider was terminated. And patients, moreover, were able to engage in physical activities and rehabilitation while working in the garden. The second case comes from Somerset Hospital, which is a 340-bed regional hospital in Cape Town, providing general specialist services, and a referral hospital for an estimated 500,000 people. And the issue was waste from autoclaves. Autoclaves typically use potable water to produce and condense steam in a pressure chamber, about 200 liters of hot water per cycle, which is discharged clean and runs to waste. And previous strategies had focused on saving water only, but not on recovering the energy content of the water. So the system that you see illustrated there was designed that would cool and reuse the wastewater and use that energy to heat domestic water by capturing the clean, warm wastewater in a 1,500-liter tank, cooling the water using a water-to-water heat pump, pumping that water back to the autoclaves, and then using the recovered energy to produce domestic hot water at 60 degrees centigrade. The installation has water meters and temperature indicators for monitoring the performance. And the results published in the case study were the reduction there in water consumption of 5,000 liters per day, 6,000 liters of domestic hot water from the waste heat per day, and cost savings in excess of $15,000 per year with a payback of less than 2 years. And since this installation, this project system has been rolled out to other hospitals. Also in the city of Cape Town is this third case study, the District 6 Clinic, which is part of the Western Cape Government Department of Health, was commissioned in 2018 amidst an intense drought. Cape Townians will remember it as day zero when the city was in danger of running out of water, and so water saving was on everyone's minds. And so the new clinic was fitted with a rain harvesting system consisting of 2 sets of rooftop reservoirs. The first set is 2 5,000-liter tanks supplying all wash hand basins with potable municipal water. And the second set are 5,000-liter tanks for sluices and toilets, supplied by 6 5,000-liter tanks, fed from roof runoff via hidden downpipes to the basement, where cool temperatures and an absence of UV light restrict the growth of organisms. So a 2-tier filtering system was employed to maintain the quality of the water. Firstly, at the collection point to the downpipes inside the gutters is an external siphoning filter, which prevents leaves from entering the system. And then secondly is centrifugal filtering. So before the downpipes enter the basement reservoir, there's a mechanical self-cleaning filter which flushes all remaining debris down the stormwater system so that only clean water enters the tanks. And the results from this during the period measured were very impressive. Rain harvesting translates about 4.1 millimeters of rainfall into a kiloliter of usable water, using average rainfall statistics of 700 millimeters per year. The facility was projected to harvest approximately 175 cubic meters of water per year. And during the period measured, March to June 2018, harvested water contributed to 21% of the facility's total water consumption. The cost savings were not included in the case study, but no doubt over the lifetime of the project, they will be considerable. And then the fourth case comes from the Tele Mokhorane Regional Hospital, an 821-bed hospital in the city of Boksburg with more than 1,500 staff members. So the history is that during 2014, 2015, the hospital experienced such poor waste segregation that the local municipality returned all general waste, which contained medical waste, to the hospital. So sorting of waste was then introduced, but the initiative failed when the service providers started missing payments and later stopped collecting the recyclables. So in 2016, audits on waste segregation and staff training were instituted, and a community member was assisted with collection of recyclables, but with no remuneration for the institution. So in 2017, the environmental health practitioners introduced a recycling initiative to create jobs for 3 community members on condition that the institution would get some revenue back. A checklist was developed to track healthcare risk waste generation rates on a weekly basis, and the quantity of both general and healthcare risk waste is evaluated on a quarterly and annual basis. So the lessons learned, they said, was that there's no right time to start implementing change, as there will always be resistance to changing behavior. The longer one waits, the harder it will be, but it becomes easier when you involve and empower the community, as they did in this project. Okay, so that brings me to the end of the 4 case studies from the Global Green and Healthy Hospitals Network. I'm indebted to Ms. Aziza Rangunwala, who's the Africa coordinator and who runs workshops for hospitals. Attended one in the Western Cape just last week. And there we heard progress on what is being done with engineers and hospital managers, some of whom have contributed to the case studies that I have presented. And there you can find more on the Global Green and Healthy Hospitals website. Thank you very much.
Thank you so much, James. Keep the questions for James as well on the Q&A platform. We'll consider those and then we'll discuss those questions later after our last speaker. Now I will introduce our last speaker, who is Professor Saloshni Naidoo. Professor Naidoo obtained her medical degree from KwaZulu-Natal and became a public health medical specialist and also an associate in the Division of Occupational Medicine in the College of Public Health, KwaZulu-Natal. And also she obtained a PhD from the Institute of Risk Assessment Science in the Netherlands. And also she is the program director of the DSI Africa NIH grant titled Research Training on Harnessing Data Science for Global Health Priorities in Africa, which is a joint between Harvard University and KwaZulu-Natal. She's also a co-investigator on the Asenza project, which is also a birth cohort study now in its 3rd cycle of funding from the NIH. She has previously led a cohort of project studying the impact of prenatal pesticides exposure on maternal reproductive health and infant neurodevelopment in KwaZulu-Natal, South Africa. I want to welcome you, Prof.
Good afternoon to everybody, and thank you to Vincent and Haley for inviting me to present here. I'm going to be, and good afternoon to everybody online. I'm going to be presenting a case study from KwaZulu-Natal in South Africa. So I'm on the east coast of South Africa. And this case study will actually make reference to some of the WHO tools that Rudolf was speaking to. So in South Africa, we are not any different from several other countries globally, and we've experienced quite a few adverse climate events in the recent past. So floods, droughts, snow, heat waves, and lightning strikes. This has been quite common occurrences. And as I've mentioned, I'm based in KwaZulu-Natal, which is the 2nd most populated province in our country, with about a population of about 12.9 million. And we as a province between 2021 and 2024, we've experienced severe flooding on more than one occasion. And in 2022, when we had major flooding, we actually had more than 40,000 people who were affected and about 440 deaths. More recently, we've experienced a tornado, yes, a tornado, and we've been experiencing unusual snowfalls. And it is not uncommon for us to have quite frequent episodes of drought as well. So taking into note all of these unusual or climate-related adverse events that we've been having, We've been in health talking around how do we make sure we are able to build a resilient health system, but also how do we ensure that we are responsive as a health system and as healthcare providers. And bearing that in mind, we've actually working with our different stakeholders, communities, and the Department of Health, we've actually sought to develop a project which we refer to as the Weather Project, where we are looking to develop an early warning system, which will help alert both communities and healthcare providers so that they are able to respond in the event of adverse weather. And particularly, we're starting off focusing on flooding. Coupled with this, we are looking at how we can actually build a sustained and resilient health system. And you'll see that on the slide, the map showing our project area. We're focusing on two of the hardest hit health districts in KwaZulu-Natal, and that is eThekwini and Ugu, which is in the south of KwaZulu-Natal. And this is actually a collaborative project between our university and universities in the United Kingdom and Ireland. And we funded by the National Institute of Health and Care Research in the UK. So to be able to implement this project, we've drawn on a tremendous amount of expertise and pulled together a transdisciplinary team. Because we believe that in order for us to build a resilient health system and to be able to respond to the adverse events that we're seeing, we can't, as clinicians or just working in public health, do this, but instead we do need the help of geoscientists, of artificial intelligence experts, and computational science, and also biostatisticians and our health economists. So this is just our team in a nutshell. Our approach to this project has been very much one of integration and community participation, involving the community from the very beginning, so that as we build this resilient health system, we are able to respond to the needs that they have during an adverse event. We've also involved government, in particular the Department of Health in KwaZulu-Natal. Our non-governmental organization who is our community engagement liaison officer in this project is the South Durban Community Environmental Alliance, which is a non-governmental organization who's been involved in quite a bit of environmental advocacy in the South Durban of KwaZulu-Natal. And then, of course, there is the involvement of all of our academics. What is our approach to this project? And really there are 4 parts to the project. Our first part is focused on evidence gathering. So we're looking at what the trends are in KwaZulu-Natal in terms of disease burden when we have these adverse events. And this is going to inform a pathogen containment tool, which we will develop and train healthcare workers on how to use during adverse events, in particular flooding. The second part to our project and what we've started working on is actually using historical data provided by the South African Weather Bureau. This is historical weather data. And we also are measuring current weather as well, rainfall patterns and river water levels using river sensors. And the current data collection is informing the gaps in the historical data. Together with that, we are using this data to develop prediction models. So we will be able to predict adverse events. And if we have an episode of flooding, we will be able to predict this. And our intention is to predict this within or at least 72 hours before it happens, so that we are able to alert communities and alert the Department of Health and the local health facilities, so that they are prepared and ready to respond. At the end of this, we will develop an app which can be downloaded onto cell phones. And we will also use a SMS system for hard to reach populations in the province. We bear in mind that we don't only have an urban population, but we have quite a large rural population who we have to be able to reach as well. So this is coupled with, and you may ask, where's the health system's resilience in this? The third part to this project, and what we've started with, is actually using the WHO tools that Rudolf presented earlier. We focused on measuring the climate resilience of our health system. At first point, we are looking at historical data, which the Department of Health is providing to us, to understand the overall burden of disease at the time of the adverse events. We are also engaging with the community. So we've chosen communities which are at high risk for flooding. And through community surveys and focus group discussions, we are building an overall picture of, and we're mapping community resilience, community behaviors, and the way in which they actually access healthcare facilities during adverse events. But importantly, we also are trying to understand what these communities expect of the healthcare system during these adverse events. So how can, or at least how would and should healthcare facilities respond to the community needs? And then using the current WHO tools, guideline documents for assessing resilience of the health system, we are doing two things: auditing healthcare facilities in our chosen research sites to understand the state of the healthcare facilities at the moment in terms of climate resilience, and identify the gaps in that. But we also will be studying healthcare workers' knowledge and practices during adverse events and their knowledge of how to respond. These together will be used to actually inform training modules that we are developing focused on leadership, risk assessment facilities, and disaster management responses, so that we can build capacity amongst the healthcare workers and ensure resilience of the health facility to be able to respond. These tools and the training, while we are actually doing this for our study sites, will actually be rolled out through the whole province. We are working with and linking with the provincial Department of Health's training and education platform for healthcare workers, through which we will implement the training modules. And then finally, it's important to understand whether this actually is beneficial to the community and to government. And so we will be doing an economic costing. It will be happening in parallel with some of our other activities. So we are going to be doing a realist evaluation and a social return of investment process evaluation to inform the other aspects of the project as well, but also to ensure that we are able to develop something that is sustainable for the communities that we serve in KZN and the Department of Health. So we are currently in the first year of this project, and we have started on several of the elements of it. and we've been funded for 4 years. So at the end of it, we are hoping that we will be able to work with communities and the Department of Health to actually build on the resilience in the communities and the facilities. So this is essentially what we hope to achieve at the end of it. Using environmental data to link to the communities, building a resilient health system through training to be able to support communities as well. So yeah, this is my final slide, and I just want to acknowledge all of our partners and our funders and the communities that we are working with. Thank you.
Thank you so much, Professor Naidoo. And please, participants, just keep the questions in the Q&A platform for Professor Naidoo. And I will now jump into the panel discussion, and I'll have some few questions to all of you presenters. And I will start with you, Rudolf, since you have not spoken quite some time now. The first question that I want to ask you is, what are the key elements that should be included in a sustainable medical waste management framework tailored for low-income country or for a low-income country, considering the challenges of limited resources, infrastructure, and environmental impact on climate change? On climate change and public health. I don't know if you got the question.
Yeah, I got it right, and I think that there are a number of issues that you need to think of. First is obviously the health workforce. It's the very important component. They are the ones supposed to manage this and also ensure that the protocols are adhered to. If you look at the examples that I gave you, obviously it's somebody's decision to throw waste and burn it. But again, there are systematic issues. So if the system itself has no good way of disposing waste, then again, it becomes problematic. So I think that, like I already said in my presentation, there must be decisions. First, policy is important, or a boardroom decision is very important as to what we need to do. We need to invest in the health workforce, and then we need to invest in the infrastructure. And for me, it's not about the biggest technology that you can always get. It's about how you can do things right. Like I gave you in the example, people can just send their own bags to the hospital and pick medicine without having to use a polythene bag. And then again, do we need to dispose? What has happened to waste segregation? It's very basic. So for me, I think that in all our policies, these things are there. What has happened to waste segregation? We don't even do it. So for me, I cannot really say this is important or that's all are important, but we need to have the legal backing or the regulation or the boardroom backing. Our health workforce must be trained appropriately. There must be basic infrastructure to ensure that this is done. And most importantly, people have to be accountable. So it has to be integrated into the health management information systems to make it work. Thank you.
Yeah, thank you. Maybe as a follow-up question to that, the other question is like, with much of the discourse on extreme weather events and the health systems resilient centered around infrastructure aspects, shouldn't we shift the focus to a deeper economic, social, and political challenges that underpin Africa's lack of climate resilient health systems?
Yes, Vincent, you know my stance already. I think there is a political thing. I think that the decision, as much as we scramble for roads, we scramble for hospitals, our politicians are kind of forced to provide roads. So I think that we, the citizens, again, have a role to play in this. And then the idea is that, okay, fine. We already investing. We invest in hospitals anyway. But like, how do you invest in that hospital? Cost is the big problem. But how do you invest in it? So like the example I showed you, why would I spend thousands of US dollars to build a hospital in a flood-prone area when I could have taken the decision to build it in a high area so that everybody can attend? So it takes both commitment, and I think that the citizenry, the risk perception, the capacity is a problem. But what I insist is that we have to mainstream. We make sure that we make the best investment. So exactly why then I said that okay, we have to begin to look at studies around cost benefit analysis. Because if you are not able to demonstrate the benefits to the politician, they are not going to do it. And then again, it's about climate justice. That health facility I showed you, the principle or the convention in building rural health facilities in Ghana is that somebody donates land. And I asked myself the question, why should I, who is already suffering from the effects of climate change, have a good land that I am farming on, donated to you to build a hospital, which you probably even charge me for attending the hospital? It's simple. It's common sense. I'll give you the worst of land, the land that I don't ever need. So I think that basically these are the things. It's not just about infrastructure. It's not just about technology, but it's about our situation. We are collaborating and we are looking for the best effective way of investing in climate resilient and sustainable actions. So that is how I would see it. It's more or less the homegrown thing. Not something that should come from outside. And we must always mainstream it. Mainstream it is key.
All right. Thank you so much for that elaborative answer. And I want to have a question for you, James. The question is, given the increasing unpredictability of rainfall due to climate change, what alternative water sources and storage strategies should communities in drought-prone areas consider beyond traditional rainwater harvesting, and what steps can be taken to ensure sustainable water across during prolonged droughts?
Sure. Well, that's a big question. Yeah, so certainly one starts with water efficiency. So saving water wherever possible. I think as I reflect on the response of Cape Town to the Day Zero water crisis in 2017, when we were at serious risk of running out of water and there was general panic set in, the way we got through it was really a lot of health education and messages through the media from the authorities around individuals taking charge of reducing their domestic consumption. There was talk about desalination and expensive projects like that never reached beyond the concept stage. Thankfully, we didn't need to. And I think it sensitized everyone, as to how much water could be saved by people installed rainwater tanks. And then within the healthcare sector, the examples that I shared were accelerated. And people became a lot more aware of, turning taps off. So yes, really the collective response from a lot of people doing maybe just a little bit was actually in the end far more effective than big expensive projects that were proposed. And I think that lesson can be translated into many other communities where affordability and community involvement under good leadership and clear communication is key. Thank you.
Yes, thank you so much. Maybe just a quick one following that. Did the community garden project include composting vegetable material from the hospital cafeteria?
I'm not too sure about that, actually. Perhaps my colleague from the Green Hospital Initiative can say more. They did have the challenge of manure not being available in the first year of the project, but that is a good question, whether the kitchen waste was going into enriching the soil. And if not, that is certainly something that I would hope. But I can't tell you the answer to that.
Well, no problem. Yes. To you, Prof. Naidoo, what are your thoughts on the need to critically examine the role of data in guiding climate action, particularly in the context where historical data may not align with the future challenges? How do we account for these margins of error when assessing the climate resilience of future health systems?
So thank you very much for that question. Yes, I think it's very important to use data. And I acknowledge that a lot of our data does have gaps. And so we will have to marry that with collection of new data. So where possible, we will have to put into place systems, monitoring systems, to be able to add to what we already have, so that we're able to use that to inform the decisions and the planning that we actually have to make going forward to, in terms of responding to these events that we're seeing and building resilience of our health systems. I think data-driven decisions are very, very important, especially within the context that we find ourselves in Africa, where, economics, we have to deal with the pressures of economics and budget constraints, etc. Thanks.
Yes, thank you. Someone is curious about the processes and approaches you are using to involve communities in your work.
So from the very beginning, in fact, even when we were planning this project, we linked with the communities. And I think that's partly because as a discipline, when we had these adverse events, we were actually linked with these communities. And also we have a long history of working with the community organizations, the CBOs and NGOs in these flood-affected areas. So there is already this established relationship. And because of, I think, the historical past that we come from, there's a lot of activism within communities. Now there's activism around not just political issues, but environmental issues as well. And it's happened over several years, a long history of exposure to the oil refinery in the Durban South area, where there's a lot of air pollution because of it. But now, this advocacy and activism is now focusing on the climate related. So there is this established relationship, and we've always maintained that if you want something to work, then you have to involve your stakeholders and you have to listen to them. So we are working with community leaders, but also the community leaders, councillors, link us with the community. And so when we were developing this project, we had lots of meetings with communities to understand what they want and what they need, so that we could actually respond to their needs through the project. We have this firm practice that whatever we do in terms of research is not just about research for the sake of research, but it's operational research to answer questions that communities and the health sector are facing. Thanks.
Yeah. Thank you so much. Now, I want to just give you 30 seconds, each of you, to answer this question. How do you motivate health workers or professionals to pick interest in sustainability, seeing the value of learning climate resilient health systems science? So maybe we start with you, Rudolf.
Much. I've done a study on this as part of my work, and then every single health professional that has been exposed to this framework, they like it. They see it as the way to go. So they are already motivated because it advances their influence, and then it advances their objective of health, advancing healthcare. Now, the systems are the problems. There's lack of capacity, there's no financing. But I believe that if we train them, we are able to attract some kind of financing. For instance, a lot of NGOs and other development partners come to partner with public health institutions. And then again, they come to partner probably just for health system strengthening. But if you come to me and I tell you, look, you must show me your climate action efforts or your climate resilience efforts, then you see that people are kind of forced. People that have money are forced to take climate considerations when working with health systems. So I think that building capacity and then putting in place the right frameworks is self-motivating. And then it even, for me, from what I know, it would actually improve the financial situation of health systems regarding funding from partners. Thank you.
Thank you so much, James.
Sorry, you're asking me, Vincent?
Yes, I was saying you can also chip in for just a few seconds.
Yes. So my particular research interest has been around educating health workers around planetary health and sustainable health care. And so I would agree that capacity development through education and training, and that is happening through courses like this and through curricular change around the world. And I think in doing that, really emphasizing the agency that health workers have, as generally trusted sources of information, as early responders, as active citizens, as individuals who have perhaps a systems understanding and perhaps developing systems thinking, so that they're able to understand the agency both at an individual, community level, at an institutional level, at a policy level, is something that we really need to be working on. And then having networks like the Global Green Healthy Hospitals Network, where case studies are being shared. Over 2,000 members are now part of that network, seeing how others are problem solving and coming up with solutions inspires change. Thank you.
Thank you to you, Prof.
So my thinking around it, in addition to all that has been said already, is that when our healthcare workers see examples of success and what is possible, and you include them in decision-making and planning, you actually can motivate them. And I think post-COVID, considering what people have endured during COVID, my experience has been that a lot of our healthcare workers are actually wanting to be a part of the solution. And so when you include them with that in that planning and the solution and decision-making, they actually extremely motivated. Thanks.
Thank you so much, all. That was a very interesting summary of events. And I also thank you for acknowledging that this kind of a course actually can also be an incentive to help professionals to develop interest in sustainability. Thank you so much. And then let me go back to my slides. All right, and thank you so much, everybody. And my apology for taking maybe 2 or 3 minutes of your time. We've come to the end of the session. And then please don't forget to give us feedback on the session. Right now, there is a link to a survey which is on the chat. Please just click on that right now. And please just start filling it and give us feedback so that we know where to improve. And also you can scan on the barcode that is presented there. Or you can, go to the WhatsApp if you are part of the WhatsApp group. There's also a link that is there for you to give us your feedback. And if you're not on WhatsApp, please feel free to join the WhatsApp through that link. And thank you so much, and looking forward to meet you again next week on Tuesday.